Minister, thank you for talking with us. 2022 has been an interesting year for the health sector. Of course, we're still navigating the COVID-19 pandemic, but for Guyana specifically, we've seen a lot of big announcements as it relates to laws and infrastructural plans. In the first instance, I'd like to focus on COVID-19 because that's dominated the conversation on health for the past 2-3 years. Where are we?
Well, first of all, thank you for having me on this program. I think in terms of COVID-19, we've come a long way from since our first case on the 11th of March 2020. And we've certainly made a lot of progress in terms of diagnostics, in terms of being able to care for patients who need hospitalization, and obviously to be able to give them the kinds of medication. We've also made a lot of progress in terms of vaccination. And I think because of the work that the healthcare workers would have done across the system, that we were able to save quite a number of lives. And I'm very grateful for their efforts, and I want to thank them for the amount of work and sacrifices that they made to ensure that the people of our country are safe.
Mm-hmm. With respect to, you just mentioned saving a lot of lives. Perhaps can you tell us how many deaths overall we've had for the year so far, and if you can compare that to the year before?
So in terms of deaths, since COVID-19 started in Guyana, the confirmed deaths that we've had was 1,286 deaths. And if we look back in 2020, it was 164 deaths. And in 2021, we had our largest amount of deaths, and that's 891 deaths rather. And you would have recalled that's because during the Delta wave, a lot of people who got sick, we were seeing a very severe form of the disease where people required hospitalization, and if they had comorbidities and they came in and they needed hospitalization, we'd seen a more severe course of the disease. And during that period, we lost quite a number of elderly persons with comorbidities. This year, fortunately, we didn't do as bad as the previous year. We had 231 deaths. This is still too many deaths. However, I think we have done much better than last year. And again, I think it's because of the work that we did with vaccination. The first and second dose, we were able to get most of the population vaccinated. And now we are in this process of trying to encourage people to take the booster doses.
Mm-hmm. I know that in the month of December, we had a COVID death. Many of us believe that COVID might be over. How would you respond to that?
Well, COVID is not over, unfortunately. I think most people, they've become fatigued, and people don't want to wear masks, people want to socialize, and they haven't been able to do this for the last 2 years. So, you know, a lot of people are throwing caution to the wind. But we should still be mindful that COVID is out there. And in fact, the variant that is dominating around the world is the Omicron variant, and it has a number of subvariants. And we have seen a lot of mutation with this subvariant, and right now some of the experts have said that there are close to 600 different subvariants. How severe they would get and how they would affect people, that's another question. So far we have seen the disease having a much milder form than previously. So when compared, let's say, with the Delta wave, this current wave is a lot milder. But over the last 2 months, we have seen an increase in cases here in Guyana. Not major increase, but nevertheless, we have seen cases going up. And so we have to be mindful, because I know there'll be lots of socializing during the holidays, and people should be mindful. We have also seen a relative decline in terms of hospitalization, but we still do have hospitalization. And right now at the Ocean View Hospital, we have about 6 persons in hospital. Thankfully, we don't have anybody right now in the ICU, but from time to time, we do get people who require hospitalization. So we're not fully out of COVID. We still have to contend with COVID. And when you combine COVID with some of the other viruses that are circulating, like RSV and influenza, then people can have a much more difficult time with the disease. So I think people just need to exercise some more caution.
On that note, given that we are seeing more milder forms of the variants, do you think it's still important to get vaccinated, or have we passed a sort of threshold for vaccination?
Unfortunately, the vaccines that were developed, what we have noticed is that the immunity would just last for maybe 4 to 6 months. And therefore, after that period would have passed, there's a need to be revaccinated. And that's why we are encouraging people to get boosters. Guyana has done extremely well in terms of the first and second doses, but we are lagging behind in terms of our booster doses. The first booster shot across the country, we have been able to administer about 76,800 doses. That's way behind where we need to be. And then there are some people who came back and took the second booster dose, but we have not passed 5,000 for the second booster dose. So we really need to get people to come and take these booster shots. Right now, there's a new vaccine, relatively new, that came out. That's a combination vaccine. It's called the bivalent vaccine, where you have a part of the ancestral strain of the virus and the current circulating strain. So these are vaccines that are currently being used in the United States, and we are working to make sure that we can also get the most up-to-date vaccine in Guyana. COVAX has promised us to get some of those vaccines to us by end of January. And hopefully when we get that, we can get more people coming out and be vaccinated as well. But if you need to get your booster shot right now, we have Pfizer, Moderna, all the other vaccines to make sure that people can get their booster shots.
Are you optimistic that people will take those vaccines? And to add to that, how long do we have before those vaccines expire?
It varies because what we've been doing now, we realize that there's been a decline in how people coming for vaccines. So we tend not to stock a lot of vaccines. And we have been getting a lot of offers of people wanting to donate vaccines to us. And we had to turn down a lot of these offers because, like everywhere else in the world, a lot of people don't want to take vaccines. So we have been trying to manage that, but despite our best efforts, if people don't come forward to get the vaccines, we are going to have vaccines that would expire.
I just have one final question on COVID-19. It relates to the daily dashboard. We've seen inconsistencies with that dashboard being disseminated. Is there a particular reason for that?
No, we have, basically we continue to gather information pertaining to COVID-19. We haven't stopped that. We have our regular meetings. But we have noticed disinterest in the data that we have been putting out. A lot of media outlets and so have not been publishing it. But if people require it, it's there and they can get the information. So it's not a problem because we collect that to understand what is going on with the disease and to be able to respond appropriately. So that information, whether it's how many people have been vaccinated per day, where they have been vaccinated, cases, tests that have been done, so all this thing we've been collecting. And of course, if anyone died from COVID, we need to know. Hospitalizations, we need to know. But it's also a general trend because of disinterest right now. A lot of the public health agencies globally, if requested by the media, they make the information available. But if it's not requested, it's there for people to access. And so we have done the same.